Everyone happy we go ahead with this?
The operating theatre, a place of hope and fear.
A lot of people are really intimidated and really scared of coming into hospital.
I'm starting to freak out a little bit.
You know I love you, don't you?
Of course I do.
For the first time ever, an NHS Day Surgery Unit and its staff have been rigged with cameras.
You've got a camera on your head.
I'm going to be filming you.
It's never a boring place to be.
Capturing a hard-working, close-knit team.
Welcome to our theatre.
Just had a birthday. Did you have cake?
Yeah.
Did you?
Yeah.
We'll get you back to the ward for a nice cup of tea.
Performing hundreds of complex operations every week.
I like fixing things.
Hey!
It gets your heart rate going.
Whoa, 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 whoa.
Can I have some help, please?
Changing patients' lives.
Stand clear, please.
Inside the operating theatre.
Look at that. That must be a world record.
Surgery's scary. You know, if you're the one having surgery, it's,
That's right, yeah.
it's terrifying, and it's just remembering that that patient hasn't done this before, maybe.
Doing really, really well, okay. Doing brilliant. Well done.
I think caring is the main thing, isn't it? Yeah. You wouldn't do what you do if you didn't care.
We try and calm them and make sure they're relaxed and feeling okay.
You're just in the waking up room, sweetheart. It's all done. It's all finished.
It's just the reassurance, isn't it, that we're there for them, and that helps them.
Yeah.
Every week, over 200 patients have operations here in day surgery.
Hello, can I help?
Hello. Yes, just checking in. Thank you. So, you know, expecting. I don't know what to expect really. I just want to wake up and it's all done and over with. And I'm hoping not to know very much about it.
That's lovely. If you take a seat and they'll come and call you when they're ready for you.
Thanks very much.
Thank you.
Stephen's due to have surgery on a condition that's threatened his health for over 6 years.
This operation for me will take the worry out of what's going to happen in the future, because it's not something that just can be left. It will deteriorate. I've had it for a while and it's got more and more prominent.
Okay.
Yeah. I'm accompanied today by Lisa, my lovely wife, who is looking after me and trying to keep me calm. We've been together 33 years. I hope I got that right.
So Steve and I met about 34 years ago. I went to work for him in his estate agency. There's quite a big age gap between the two of us, and when we got together, lots of people said it would never last, you know, the usual sort of thing.
Stephen?
Yes?
Yeah. Do you want to come through, my darling?
I think when you have any operation, it makes you feel vulnerable. Especially like Steve has always been a very fit person. And I think it just brings it home that without your health, you haven't really got anything. Another reason why Steve's particularly nervous is that his uncle actually died having this operation done. So it's, yeah. So you can understand his anxiety that it's, you know, it's something in the family.
Stephen's here for an operation to remove the long saphenous vein which runs down his right leg. The valves in this vein aren't opening and closing properly, which has caused a large area of varicose veins.
In my case, it's a big clump of blue knots, really. It's been described as a couple of pickled walnuts by a friend of mine.
Stephen's operation will be performed by Mr. Redwood.
It's not an operation that should be undertaken lightly, even though it is a day case, because there is potential disaster with bleeding and damaging the deep vein, so it has to be done very carefully.
The condition is hereditary and makes Stephen more prone to blood clots, which can be fatal.
My father had a varicose vein which became a thrombosis, which I want to avoid for obvious reasons.
Hi.
Emily will look after Stephen on the ward.
Any questions regarding that?
No, not really, no. I mean, obviously, it's all very... I feel numb anyway.
Okay.
So some of it's going in.
Quite nervous of everything.
Yeah.
I'm going to look after you.
Good, thank you.
So, the plan is cut in the groin, tie off the vein at the top of the leg, pass a stripper down, strip it out. The reason we've not gone for the minimally invasive is because of the size of it. It's huge. Main risks, like any operation, infection, bleeding, bruising. There is a risk of getting a clot in the leg, and there's about a 1 in 10,000 chance of having a fatal clot on the lung.
As it's such a big operation, Stephen will need a general anaesthetic.
We'll see you later.
Thank you
Very nervous,
All right.
but thank you.
Okay. See you later.
Thank you.
Bye-bye.
Yeah.
Bye-bye.
One of the things that Steve said to me, that his main anxiety is that having the operation, if something didn't go to plan, it could jeopardise what we've got as a couple.
Nice chap, isn't he, Mr. Redwood?
Yeah.
No, I love you.
What are you trying to do?
Hello, hi, I'm Nikki. I'm going to take you around to theatre now.
Okay.
So, you know you're coming in for your right long saphenous vein, high tie and strips. Are you happy? And you signed it.
I can't say I'm happy,
Well,
but I'm going through with it.
Yeah, you're happy.
I'll go through
Yeah.
with it.
Excellent. I'll leave you that copy for
Thank
you
you
all.
very much.
Thank you. All right.
Right. See you later.
What have you done? See you later.
Yeah, see you later.
He's so nervous for such a big man. Yeah.
So what we're keeping you from today, Steve?
They'll take really good care of you.
Yeah, yeah.
Well, it's a nice day, so I'd be out with my dog.
Yeah.
Or generally anything that gets me outside.
Gets you outside.
But he's just really been walked off to the theatre now. Just saw him go. Had a cuddle and told each other we love each other. Sorry. Come out of nowhere.
If you pop your dressing gown off for me and your slippers.
I told him I'll be there when he comes out. I know he'll be fine. He's just such a big bloke, 6'4". You know, my rock. And I said to him, even there, you know, if I could have it done for you, I would. But obviously I can't. So it just, I want him just to be back with me and be fine. I'm sure he will be.
Stephen is especially nervous. His uncle died as a result of this same operation.
This procedure has the potential for lots of danger. The real risk is that you can mistake the deep vein for the surface vein. If you cut it, there is an awful lot of blood that can come out, which causes great concern while you're trying to repair it.
I'm trying not to think about the risks. Obviously, there are always risks whilst you're being operated on.
We're doing a right long saphenous vein, high tie and stripping and multiple stab avulsions.
You have to place your faith in people and trust them for knowing what they're doing.
So some oxygen coming up, just breathe away as normal.
Think about a nice walk on the beach and it'll all be over before you know it. No, let's just go on. Oh. That's the only one, isn't it? Only GA? Yeah. That's fine. Yeah.
Okay, everybody happy? Thank you very much. Right, first thing we've got to do is find the main surface vein. There it goes, arteries here. The operation starts with a cut in the groin, down through the skin and the fat. There we go, so this is the surface vein here. So the next thing to do is to find, before we tie anything off, just find the main vein so we don't damage it. There we go, just see the surface of the main vein. Let's have a 2-0 tie. That's good. Right, the next step is we have to strip this vein out. Pass the stripper down now. With a bit of luck, this will go straight down without snaring. You feed the stripper down the leg. See it just moving under the skin here. There we go. When you've located it near the knee, you can make a little cut and pull the stripper out through the skin. Stabby blade. There we go. Let's see if we can find this thing. That's it. You then tie the vein at the top to the stripper and pull the vein out by it inverting itself within its own track. Right, so we'll start the strip. Oh, come on. Damn. Damn thing snapped. We're going so well.
Hello, Day Surgery. Rachel speaking. Can I help?
Hiya. What's the name, please?
Trisha Bobbick.
Lovely. Take a seat. They'll be with you shortly.
Okay.
Let me see your nails.
Oh, look at them. Look.
You've booked in to have them redone?
Yeah.
Tomorrow? I knew it. You might not feel well enough.
They've got me in pretty quick. I came last Friday and within a week they've got me back to have further investigations.
Have I got a Patricia, I'm going to say, is it Bobbick?
Yeah. They're hoping to find out from this procedure why I'm intermittently bleeding. I think as a 56-year-old, when you're halfway or through the menopause, you're not supposed to bleed. So the best case scenario would be that it's just polyps and they can remove them and I'm okay. The worst case scenario would be that they find anything cancerous.
Trisha is here for an investigation of her womb. The surgeon will use a camera and then take a biopsy.
Keep calm, keep calm.
As soon as you think about it, you get all tense.
Hello?
Hello.
Her surgeon is consultant gynecologist, Mr. Rizoma.
Okay, so similar to what you had the last time.
Yeah.
In the outpatient setting. Okay, so this time Same kind of thin camera which goes in through the neck of the womb, and we have a look inside and take some samples.
Right.
So exactly what you had the other time, but this time you're going to have it while you're asleep.
Right.
Okay?
A little bit apprehensive about the procedure. I'm a bit of a scaredy cat anyway. Once I'm under, I'm not going to know a lot anyway, am I? So. My very good friend Jo is staying with me because she knows I'm a baby, and she'll be taking me home.
Patricia Bobic?
Yeah.
My name is Dr. Reddy. I'm one of the anesthetic consultants here.
Okay.
Have you had any anesthetic in the past?
I have, yeah.
Okay. Any problems with anesthetic at all?
No.
No, okay. You okay?
I just don't like that needle going in.
Don't worry, I'll try to use the smallest needle possible so that you don't get much pain from it. Okay.
Oh, that's kind.
Okay. Let me see, yeah.
Staff nurse Sophie applies a numbing cream to the area where the needle will go in.
Okay, you idiot. Oh, wow, it was.
I bet it don't work anyway.
I'm just going to use the small needle.
Oh, I hate that needle. Oh, God. I've been quite calm up to now, but now I don't want to go now. Oh, shall we just go home?
Yeah. Oh, yeah, let's just go, yeah.
If it happens again, I shan't go to the doctors about it because I ain't going through all this again.
You've got to get it checked, don't you?
For most patients, even the mere fact of coming into hospital is quite stressful. And even more so if you know there's a possibility you could be diagnosed with a cancer. Coming in for hysteroscopy, B&C biopsy for postmenopausal bleed.
The results, if there's anything sinister there, will have an impact on my life. Hopefully it is just polyps or a thickening of the lining that they can take away, and then it won't.
I'll be just 1 minute, okay?
All right.
Right, it's that
Hello.
time.
Yeah. All right. See you when I get back.
Good luck. Be brave.
I'm such a coward.
Is it the needle?
Yeah. I'm done.
Well, if you'd like to just go through.
Hello.
All right. Put yourself up on here.
Right, Lola, your Amitabh should be working now.
Okay.
Okay?
Yeah.
Feeling alright?
Yeah.
Should be fine, don't worry, lovely. Going to use the smallest possible cannula we can, alright?
I'm not going to even look.
Can make your fist go like that a few times, please. Close and open. As hard as you can. Excellent. That's fine. Let your hand go loose now. I'm just tapping your hand, alright?
We'll warn you before we do anything. No, just do it. Don't tell me.
You alright?
Yeah.
Well done.
All right.
Yeah.
Excellent. Well done, lovely. Doing ever so well. Nice deep breaths. Nice and big. Well done.
Okay, well done.
Slowly drifting you off to sleep, okay? Excellent. Okay.
Stephen Chewy is midway through an operation to have his saphenous vein stripped from his leg.
Flip. You're going so well.
As the vein was being pulled out, it snapped.
Complications do occur The hours and hours of training that surgeons undergo are for these very eventualities. It's how you deal with complications where things don't go right that's really important, so that you always get a good outcome, even if you hit difficulty. You just have to sort it out. Blade, please. Yeah, stabby blade. I have to make another little incision. Yep, that's it. That's it, it's got it. Excellent. Right. It should come. Here we go, that's it. Right, okay, done. So, do you want to close that while I just do some stabs down the leg? So having stripped the vein out, the next thing you do is remove the remaining varicosities in the lower part of the leg. Some nicer ones up here. You make a tiny little stab with a blade, then using a very fine hook, you push this under the skin just to catch the surface of the vein and retrieve it out. You can then pull them out to get rid of them. It does look pretty brutal, but it has been tried and tested. There we go, that's it. The nice long worm coming out. You will perhaps see how long some of the pieces we retrieve are. Oh, look at this. This is going to be a personal best. Keeping going. Oh, look at that for an avulsion. That must be a world record. You saw it here first. Ah, there we go. Fantastic. When you get the nice ones like that, they just keep coming, is great. There we go. Lovely, jolly good. Thank you very much, everybody.
In recovery, Matthew will monitor Stephen as he wakes up.
Are you feeling okay, Stephen? Sit you forward a bit more. Just get your bearings. There you go. You're in the wake-up room, it's all done. Let's try you without this oxygen. That's it. You seem to be coming round a little bit. What do you normally be doing today then, Steve?
Walking the dog, probably.
Oh, okay. What sort of dog have you got?
Sprocker Spaniel.
Cocker Spaniel?
Sprocker.
Sprocker Spaniels. Lively then?
Oh yeah.
Right, let's get going then, Steve.
Okay. We're going straight onto the A10, are we?
Straight onto the A10, yeah.
Yeah.
Right, yeah.
Stephen's surgery took an hour and a half.
Whereabouts were you, Steve, do you remember? It looks like someone's ears have tweaked over there.
Hello.
All right.
Yeah.
Okay, and all the best to you.
Thank you very much.
All
Thanks
right.
for your help.
Take it easy.
Cheers,
Thank
sir.
you.
All right.
Bye. How are you doing?
Am I your hero?
Yeah.
That's all right then. The recovery period from the operation, I was told, 4 to 6 weeks.
So Mum says, thank goodness all done and good result. You both must feel relieved. Much love to you both.
Hello.
Hello, Mr. Edward.
Hello.
How are you?
Oh, I'm very well, thank you.
Good.
Yes, it's a bit painful, but they've given me some codeine, so...
Splendid. Yep,
Yeah,
it's
yeah.
all gone, all done. We did have a slight problem. The vein didn't behave, sadly. We were hoping to get a nice long piece strip out, and sadly sometimes it did snap halfway through.
Oh, okay.
So we had to make a separate little incision down the leg just to retrieve it.
Oh, you got it all anyway,
Yes,
that's
yes,
the
we got
main
it good,
thing,
yeah.
yeah.
Okay,
Thank you
all
very
right,
much.
bye-bye, bye-bye.
Stephen's now free to go home.
Do you think that'll be enough, or do you want to put the jumper on with this?
Haven't I got my pants on?
No.
Oh, I didn't know that.
Someone's taking your pants off.
Girls ripped my pants off.
What's the difference between a surgeon and a nurse? Oh.
Common sense.
Money.
A sense of humour.
45 grand and a BMW.
Can we have a self-retaining retractor, please?
Trisha Bobick is about to have a biopsy which will determine whether or not she has cancer. Consultant gynaecologist Mr. Azoma will perform the surgery.
Covering.
We have an instrument we call a hysteroscope, which is set up. It has a light source, it has a camera. Then we gently try and put this camera in through the neck of the womb.
Can I have top lights off, please?
I can see all the way into the lining of the womb. What we worry mainly about is the possibility of having an endometrial cancer. So what I'm looking for is areas of irregularity. Are there areas that are very red and vascular, angry looking? And are there any areas where there's a mass you can see clearly? So these are the things I'm looking for.
Okay, top lights on.
So the only way we can tell for sure if somebody has a cancer is by taking these samples from the lining of the womb and having it tested, having it looked at under the microscope by the pathologist.
So, sending this to the lab, what kind of answers can you have?
No, tell us anything unusual. Let's see if I can get more. Okay, we're all done. All done. Thank you.
Trisha's operation took just 15 minutes.
Hiya.
Hiya.
Are you alright?
Yes.
Good. What's the name?
Mr. Coakley.
Quickly, yeah, lovely. Just take a seat and give all the information to the nurses.
Just here?
Yes, please.
You walk along with your right eye half shut, and people tend to look at it and stare at you and make comments behind your back, sort of thing. But with this, it makes you look normal, if that's the word for it. You're just part of the crowd, you know? It is a life changer, yeah.
Louise will be looking after Dennis.
Dennis Coakley. Gotta follow me through, my darling.
When I was a child, I had measles, and it affected my eyes. All my life, they used to call you pop bottle face and pop bottle glasses.
I think we're here today.
Both eyes had deteriorated, but my right eye, they couldn't do nothing with.
12 months ago, an infection led to Dennis losing the sight completely in his right eye, so he was fitted with a prosthetic.
It's basically like an eggshell if you look. It's made out of, I think it's a plastic material. The pupil and all the outside is hand painted by artists up in Blackpool. Fascinating, isn't it?
Dad.
The weight of Dennis's prosthetic eye has caused his lower eyelid to droop down. He's here to have an operation to lift it back up. His surgeon is Mr. Bayard.
Mr. Coakley, sir.
Yes, sir.
How are you?
All right, you?
Good. Good to see you.
Same to you. Same to you.
Do well. This is Mr. Red Dubis, colleague of mine today. Yeah.
I think we've met several
I've
times.
met most people here before. Dennis is a very amenable chap. I've seen him many times in clinic and in theatre, and he's always a very pleasant chap to look after. The eye was spontaneously falling out, and this was due to a stretching of his lower eyelid that wasn't holding the eye correctly back into the socket due to a fairly heavy weight of the artificial eye. He was just touching his cheek or his lower eyelid, and then the eye was coming out. So it was quite unstable. So we're just reattaching this lower lid, bringing it up. We think let's just have a look again. It's got quite a heavy prosthetic eye there.
Bulges, doesn't it?
Yeah, the lid came off.
Dennis has another unrelated condition which makes it very difficult for his artificial eye to remain in place.
Floppy Eyelid Syndrome is the correct terminology for it. It's where the collagen becomes very lax. We had one patient that lost their artificial eye in the vegetables in Tesco once. So an eye falling out is never good. It's children get very scared and people get very alarmed if that happens.
Will there be much more you could do?
Once we try and get this lid up, hopefully we get the eyes a bit more balanced, and then we'll see from there as each stage we go. Just put a mark on you there on the right side. It's always tricky with you because your eyelids are looser than the average eyelid sort of thing, so they will stretch a lot easier in your case.
They always said I was different.
Exactly, yeah. But we'll try and get you more symmetrical, and then we'll
take it from there.
Yeah.
Okay,
Good. Okay, so well done.
Thank you.
It's a very visible part. Everybody looks straight at someone's eyes, and the better we can make that result, the better. It's they're living with that result for a long, long time, those patients. So it's for us to take extreme care and doing our best to put that eyelid back together again.
Present.
Thank you.
You're welcome. Thank you. You need that. Oh no, when you need a drink. Mum was like that.
I married Gillian with 3 children, and we had 2 of our own. We was married for 34 years, and she just retired, and she's got, I'm afraid she's got pancreatic cancer, and they couldn't do nothing for her, and that's just how it was, like, you know, the cancer just took over and that was it.
After his wife died, Dennis moved into assisted living accommodation.
I think she was my rock, you know? She was my rock.
Shall we go get this done?
All right, this is Dennis. Take a seat in the big chair for me.
So.
I'm going to sit the chair back and just relax and go with it. So we're just going to pop some drops in, a bit local anaesthetic, get your eye feeling numb.
Dennis's operation will be done using a local anaesthetic, so he'll be awake throughout.
I'm just going to remove your prosthetic eye to start with. Give it a clean. Just look up for me. Yeah, looks good in there.
He must lie as still as possible during his surgery.
cotton bud, please. We will form a stump as such on the end of the eyelid that we attach to the edge of the bone, just inside the inner part of the bone. And that provides a strength to the lower eyelid and a securing point. And I often compare it to a hammock. So we're reattaching back where the lid has become stretched. It'll feel a bit tight to start with, sir, but don't worry.
Okay.
We place the sutures partially inside underneath the skin, and they will dissolve, and then we close the skin over the top and reattach the upper and lower eyelid so it forms a normal angle on the outer edge. We'll see we get it about 3-4 weeks. We're oozing a little bit here, so we might just put a pad on this, sir.
Okay.
Okay, so time out, we've performed a right lower lid reattachment. The procedure has been recorded and I've got no concerns for recovery.
Get rid of that. How are you feeling?
All right?
Yeah?
Yeah, fine.
Alright. You get a ride back anyway.
Are these your glasses?
Thank you.
Might just have to sort of perch on the end of your nose a bit.
Yeah, maybe
It's not as bad as the plastic.
That's it.
Oh, yeah.
That's all right.
Fine.
So, you've got a camera on your head.
I have got a camera on my head.
Is this, part of the GoPro generation?
This is it.
Can I expect you to do some somersaults and upload yourself onto YouTube?
No, I'm going to be filming you. You can do whatever you want, Mr. Bain and Phillips. This is your show. It's the Bain and Phillips show.
Trisha Bobick has just had a biopsy taken from her womb to be tested for cancer.
Okay, Patricia.
Tracy is on hand.
You don't remember anything? No, that's good. That's a bonus. Hey? It's all gone well. Okay.
Need a cup of tea.
Yeah, I'll get you a cup of tea as soon as you're back on the ward. How do you like it? Just milk? Yeah. No sugar? Yeah. Sweet enough? Yeah. Is that right? Can we confirm that? Yeah. Yeah? Do I need to ask somebody else? That's Matthew. Oh, yeah. It's my colleague, Matthew. Right. Okay? Can you see him? Yeah. Yeah? Does he look reasonably handsome? Yeah. Really? She's still under the influence, Matthew. Drugs, yeah. She's under the influence of drugs still. You can hold that. Yeah. You right, Trish? Yeah. Okay. Good. Is that your friend down the bottom there? Yeah. Thanks, Matthew. There we go. Here she is.
How are you doing?
She's all right.
There we are, white tea, no sugar, and some biscuits, all right.
Okay. What do you want, a shorty or a bourbon?
What's hot? Shorty.
Hello?
Hello.
If you don't mind. So just to let you know about the findings during the operation, everything went well.
Okay.
No concerns, no problems at all. Everything was quite straightforward. And the womb looked absolutely fine. There was nothing going on there. And there wasn't any polyps. There were no fibroids within the womb itself, within the cavity. And it all looked like we expected it to be. So we've tried and taken some scrapings from the lining of the womb, and they're going to write you with the report of that in the next few weeks.
Right.
Okay, you don't have to do anything else, okay? So as soon as you're up and about, you should be all right to go home.
Okay,
Okay?
thank you.
All right, so wish you all the best.
Thank you.
Okay. All right.
Yeah. It's just uncomfortable, isn't it?
Yeah, you're going to have a bellyache for a couple of days.
Tricia now needs to wait for her biopsy results to confirm Mr. Azoma's findings.
I'm ready to go home now.
Stephen's recovery is taking longer than he'd hoped, and his leg is still painful. However, he is managing to take his dog on short walks. Dennis had his stitches out 4 weeks after his surgery.
Thanks.
Yeah, bye-bye. Bye-bye, thanks.
He's happy with how his eyelid now looks. Tricia's biopsy results were clear of cancer. She still doesn't know what was causing her bleeding, but it hasn't happened again.